Feeling tired all the time, falling sick too often. It may not just be stress, it may be something more serious like leukemia. Let's talk leukemia this morning. What is leukemia, if we may ask? Leukemia is just cancer of the blood. Now we know cancer happens in different parts of the body, and when this happens in the blood, it's leukemia. A cancer that begins in the bone marrow. That's the bone marrow where your blood cells are formed. Instead of regular or healthy blood cells to be formed, a lot of abnormal white blood cells are formed, which eventually overcrowds the good ones and overshadows them. So that's just basically leukemia. You may ask what the types of leukemia are, of their types. Yes, we've got the acute and the chronic one. The acute one, sudden onset, deteriorates very fast. Everything happens very fast. The chronic one, a bit more slow, a bit more silent, but it's still as deadly as the acute one because over time, it also brings about the same complications and the same problems. So what would be the signs and symptoms you will notice? Like I said, sometimes silent. So initially it could be silent. Then you begin to have manifestations such as continued fatigue, always tired. You begin to have inflammation, infections, time and time again. You're treating infections. You're coming down with illness. You're being very poorly often and you have fever. You have pale skin. You have unexplained bruising. That you don't know what's happening, but you just begin to see bruises all around your skin or frequent bleeding when it's not called for or very little cut. You begin to bleed excessively. So those are the signs and symptoms. But when you notice any of this, you don't have to stay and Google your symptoms. Like I always say, go to the hospital and get diagnosed. How does this leukemia affect? It affects both children and adults. It's not exclusive to any particular age range. You can find it in children, you can find it in adults, although the types, some are more common in children, some are more common in adults. Now, how does this get diagnosed? It gets diagnosed in the hospital through extensive history taken by your medical practitioner. You've got blood tests, bone marrow biopsy. So these are the ways they can, when they match all the results here, they are able to come up with a diagnosis. How can this be treated? Now, fortunately for us, not like in the past when there wasn't adequate treatment, right now with chemotherapy, stem cell transplant, targeted therapy, other management, you could go into remission if you're treated and then eventually get with this treatment, many patients are able to recover and go ahead to lead a very, very healthy and normal life. What's your take home from all of this is to know the signs and go to the hospital as early as possible because early detection saves lives. Now, if you've learned something new, don't forget to give us a thumbs up. Don't forget to like this video, drop a comment about what you've learned, and give us a follow. Share this video to who might need it because the awareness is very necessary. Until we see again, News, your go-to for simple life-saving healthcare tips. We'll be seeing you around. Take care and thanks for watching. Bye.